Cystinuria is a rare genetic disorder characterized by the abnormal transport of certain amino acids, particularly cysteine, in the kidneys and intestines. This condition leads to an increased concentration of cysteine and similar amino acids like ornithine, lysine, and arginine in urine. Cystinuria is typically inherited in an autosomal recessive pattern caused by mutations in the SLC3A1 or SLC7A9 genes, which encode subunits of a transporter proteins responsible for reabsorbing cysteine, ornithine, lysine, and arginine in the kidneys. Normally, amino acids are reabsorbed from the proximal convoluted tubule into the blood. When these transporters are defective, amino acids are not properly reabsorbed and are excreted in high amounts in the urine. Although cysteine, ornithine, lysine, and arginine levels are high in the urine, the main symptom is caused by cysteine crystals. With normal pH of the urine, ornithine, lysine, and arginine are highly soluble in urine and can be excreted in large amounts without complications. However, cysteine is relatively insoluble. High concentration of cysteine can crystallize and form lemon yellow-colored stones in the urinary tract, kidneys, ureters, or bladder. Stones have sharp edges, which cause sharp pain in the loin and lower back, and radiate to the lower abdomen and groin when they cause obstruction in the ureter. The pain comes in waves and may be present when urinating. Stones can cause injury to tissues in the urinary tract, which can lead to blood in the urine or hematuria. Frequent recurrence can lead to renal damage. Larger stones can block the ureter and stop the urine flow. This can lead to additional complications like urinary tract infection. Cystinuria is typically diagnosed based on stone analysis or urine cysteine quantification. Stone analysis after surgical removal or passage of a stone to confirm the presence of cysteine stones. Although it is not always required, genetic testing may be useful in certain situations, such as atypical clinical presentation, determining the mode of inheritance, and genetic counseling. Management of cystinuria focuses on preventing stone formation and managing symptoms. High fluid intake is needed to dilute the urine and decrease cysteine concentration. Alkalinization of urine with potassium citrate or sodium bicarbonate increases the pH of urine, which enhances the solubility of cysteine. Chelating agents such as tiopronin can bind to cysteine and make it more soluble. Dietary modifications such as reducing sodium and animal protein intake can help decrease cysteine excretion. For removing existing stones, procedures such as extracorporeal shockwave lithotripsy or ESWL, ureteroscopy, or percutaneous nephrolithotomy may be required. With appropriate management, individuals with cystinuria can reduce the frequency of stone formation and maintain kidney function. However, it requires lifelong monitoring and adherence to treatment strategies.